And just clean that. Okay, my hands also. Now if you'd come forwards please, pop your chin on there. Just going to adjust the height of this. That's very good. Now look over at my ear please. Keep looking at my ear, please. Good, and there's the optic disc in focus. So just increase the magnification. And the first thing we do is measure the vertical disc diameter, which in this case is 1.2 millimeters with a 90 diopter lens. And look at other features of the optic disc. So in this case there's a healthy pink neuroretinal rim, some peripheral pigmentation there. There's a vertical cup disc diameter of approximately 40%, a CD ratio of 0.4, and note an absence of disc hemorrhages. And just looking around the disc, you can see a healthy nerve fibre layer, which is normal. Thank you.
Remember the rules for assessing the optic disc. Firstly, measure the vertical optic disc diameter and don't forget to record the lens you use, as different lenses will give different magnifications. Secondly, observe the features of the neuroretinal rim. Is the isn't rule followed? Does there appear to be any focal or diffuse rim loss as exhibited by bearing of blood vessels? And then note down the CD ratio. Thirdly, look at the retinal nerve fibre layer immediately adjacent to the optic disc, preferably using a red-free filter. Fourthly, look for the presence or absence of optic disc hemorrhages. You can also look for the presence of beta zone PPA immediately around the optic disc, as some feel that this is a good indicator of retinal nerve fibre layer loss. And last but not least, check for optic disc symmetry between the eyes. This is the most important rule.